Invite everyone to stand for the opening prayer and pledge.
Father in heaven, bless us as we gather today for this meeting. Guide our minds and hearts so that we will work for the good of our community. Teach us to be generous in our outlook, courageous in the face of difficulty, and wise in our decisions. Thy will be done. Amen.
I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, I'd like to call this meeting of the Hancock County Commission, Thursday, March 12th, 2020, 2:30 p.m. to order. Roll call.
Mr. President, all Hancock County Commissioners are present.
All right, before we get started, we have 4 presenters, and after you present, if you want to leave, that's totally up to you guys. If you want to stay, well, then we can conduct the business end of it. So, all right, first item is the approval of minutes from February 27th. Is there a motion to approve?
Move to approve.
Questions? All those in favor?
Aye.
All right. We're going to have a first presentation from the Health Department from Jackie Huff. Just a little update on the coronavirus. Jackie?
Hi, thanks for having me. As we're meeting, the governor's making different regulations right now. So this could be changing, but presently what I've caught is what I'll bring up towards the end here. As far as our role of the health department, I'm not going to go into statistics because they could be changing as I'm speaking, but as of this morning, there were 8 tests done in the state of West Virginia for the coronavirus. All came back negative. So West Virginia still is a big white circle. Now Pennsylvania, Ohio, and the surrounding areas have cases. So you know our close proximity, we're trying to mitigate and reduce it in public health. There are testing kits or swab kits available. I know that's been a concern and questions with some of the people as far as testing people. There are 4 criteria that need to be met before that can be done. Those were established, 3 with the CDC. The 4th one was with our state health officer. I can leave those. I don't really want to go over all the specifics, but it related to contact with people from international travel in the locations that had the virus spreading or the disease spreading. And it is a pandemic state now. So now we're finding that in the United States, it's the contact with the other people. Symptoms are like influenza, upper respiratory, pneumonia symptoms, fever, chills, coughing, shortnesses of breath. That's what the symptoms are. What we're saying is social distancing. If you're sick, stay home, cover your cough, and wash your hands. I think Senator Manchin even said instead of singing happy birthday as we did in the previous pandemic flu, to sing country roads. They also have established a 800 24/7 hotline for the general public or anybody that might have questions regarding the coronavirus. I'll leave those 2. What else can I say? It's up to the individuals in our community to help do this. We can tell you wash your hands, we can tell you social distancing, but that's something that everybody has to take their own responsibilities for. If you're sick, do not go to the ER, do not arrive at your doctor's office and call them first, alert them to what it is. They'll ask you a series of questions to determine what your illness could be or what steps that need to be taken. That way we're not flooding the healthcare system with sick people that could maybe not have the coronavirus, but that could be getting it from other people and so forth. We at the health department, with our community partners and the commission and all the other county agents, Office of Emergency Services, first responders, police, everyone, we are working closely together, dusting off our plans and making sure we're prepared for whatever takes hold. School system is also one of that. I talk to them usually on a daily basis. As of this morning, we were following the plan and school is still in session. As of presently, it is still in session too. As I said, the governor was talking just when I came in. Presently, he is restricting all state employee travel. There will be none. Non-essential out-of-state travel is also being done. And no large gatherings of the state. So I don't know if that means like all of our state meetings, session's over now, so it probably doesn't apply presently. Avoid contact for the elderly and those that have compromised diseases that could get it and make it worse for them. So with that being said, he said that he's advising all long-term care facilities to stop visitations. The only exception would be those for the critically ill and near-death persons for their family to attend to see them. And the last that I heard before I came over is the state basketball tournament is being canceled as of the ending of the game that's taking place right now. And
But
that's
that
where I was
disappointed
when I
him.
came over here. Huh?
Bet that disappointed him.
Yes, it was near tears, I think. So, any questions? Any other comments?
Just clarification, you mentioned about test kits being available. Just so the public knows, they're not available at the health department, correct?
No, those are left for the healthcare facilities. The state is able to do lab testing now. It doesn't have to go to the CDC, but the actual swabbing of the patient to send to the lab is being done by family practice office healthcare, as in hospital, or actually the long-term care facilities could do it. Anywhere that there's a clinician there to perform the test, they are left with those test kits to do that. That way they could put the standard precautionary items so that they could try to limit the spread of that disease also. LabCorp and Quest commercial labs are coming online probably by the end of this week to be able to do testing too. At this point, the whole insurance issue is coming up. Are they paid for? How is it going to be done? Certain insurances are coming out with statements that they're paying for all testing of the coronavirus, and then your insurance benefits will dictate, if you have it, how that care will be paid, at what percentages.
Okay.
Second.
Jackie, I can't thank you enough for this.
Thank you, and I'll let you know if there's any further developments when I get back.
Okay.
Thank you.
Thank you.
Thank you. Thank you.
And I take the front up here is the 24/7 hotline number, if you guys are interested in that. Okay, next we have Vivian Parsons, Public Entity Specialist, West Virginia County's Risk Pool, for an update.
Good afternoon. I can pass these to the commissioner through you. It's great. Closer. It's great to see you guys. I picked a beautiful day to get to drive up into the northern panhandle. The sun's shining. You folks know me. I think you know me best with the County Commissioners Association, which I retired from last May. And I started with the West Virginia Risk Pool on July 1 as a public entity specialist. I am bringing greetings from the pool as to how the pool is doing. And if you see the very first page of that handout, we have 50 of the 55 counties in the pool now. Hancock County is one of the more recent adds, and we are very happy to have you and hope things that are going well. Certainly, if you have run into any issues with the program, with the process, we want to know about it. We want to meet all your needs. We have about 112 of other entities that are county authorities and boards, like solid waste authorities, PSDs, EDAs. We have some ambulance authorities. So any of those boards and authorities that are created by the county commission and have a direct connection to the county, we can cover them as well. On the expansion front, about a year ago, the board approved, and we are now to the point where we can actually offer the proposals. We can offer proposals to VFDs. So volunteer fire departments, we are now starting to work with them. We're going and talking to different fire association meetings. I've actually received information from a couple of VFDs, and we're in the process of trying to write some proposals. So if you have any volunteer fire departments who may be interested, again, we're not beating their door down to sell them insurance. We don't sell insurance. But we are offering another benefit. This is something that the members have requested, the members of the pool. And bringing up members, that's everyone who belongs to the pool is considered a member of the pool. It is a self-insured risk pool of a sorts. We're the first one in the state of West Virginia. We literally had to pass the legislation back, we're in our 13th year, so 13 years ago, legislation had to be passed before we could actually create the pool. So the way the pool works, the people who join the pool and are members of the pool are owners in the assets of the pool. The pool is governed by a board of directors made up of county commissioners from across the state, and the members of the pool meet annually each year and elect those board of directors members. So the board sets the pace, so when we broaden our coverage to things like VFDs, that has to happen through the board. The latest act by the board is that we are expanding the ability to write proposals to municipalities. We have one municipality on board. We have worked very diligently to create a relationship with the Municipal League, and they are now endorsing our program and working with us like the County Commissioners Association and the Association of Counties in the past have done. So just a little bit to tell you that the pool is doing very well, very financially stable. We expect the rates to be somewhat stable. We don't expect much movement in either the property liability or the workers' comp rates this year. If you follow the national trends, you know that property liability is going up in the private sector due to all of the natural disasters that have been happening, and the tornadoes in Tennessee just a couple weeks ago, and a lot of those things that are occurring. Fortunately for us in the pool, the way the pool works and the way risks are spread across the pool, and the way we purchase reinsurance, we are able to keep our rates solid, and those risks and those things that happen get divided around the pool so that we are able to keep the rates solid. Trying to think if there was anything else. You should have received your renewal information, requesting the information to write your renewal. The renewal itself, the proposal itself, will come by the end of March. We know that you've got to get your budgets in. We hope a little earlier than the end, but as quickly as we can get them, and we do commit to getting them to you before your budget has to be back to the auditor. The other message that I bring, having about 30 years in county government, is I know that counties are asked to do a lot with a little. And when I'm talking financially now, that it's always tough for counties. And there's so much more that the pool offers beyond the tailored product in both property liability and workers' comp to our members. We have a whole risk side of the pool, and that is providing training to try to manage the risk of the pool. And that's another way that we keep those rates stable and work with the pool members. And so I just want to, if you already know about these resources and benefits, remind you of them. If you didn't know that they existed, I want to make sure that you know. They're free to our members, the training that's provided. We send the trainers to the county. We'll stay 2 or 3 days and work with you to work people in and out of the program. We know you can't empty county offices. And the handout that I gave you, the last page has, it's not an all-inclusive list, but it is a list of training that we have available. We're constantly working on new and additional training as things, as our members, local entities are confronted with different situations. I'm going to mention about 5 that are pretty hot topics right now, and may or may not be on that list because they've come about just because of the need that have faced us in our communities. One is active shooter training. Unfortunately, the day and time in which we live, that's a very real consideration, and so the risk pool has put together some training on that. Again, we can come to your county to do it. It costs the county nothing. The second one is cybersecurity. We put cybersecurity coverage in our policy about 5 years ago. And for those first 4 or 5 years, we didn't have any claims at all. So we were ahead of the curve by getting it into the policy. It was added to the policy. It didn't cost the members any additional money. In the last year and a half, we've seen some claims coming in with regards to cybersecurity risk. And nothing huge, knock on wood. Hope we keep it that way. But it's there and it's a real threat. With cybersecurity, we've also created a cybersecurity training program. It's about an hour and a half, an hour and 45 minutes. And it is not geared toward IT folks. They are on top of this and they work with it all the time. This training is geared toward our average county employees. People like me sit down at a computer, and no matter how many firewalls you have in place, no matter what kind of technology you have in place, it's only as good as the weakest link. And many times that's somebody like me going to the wrong place, hitting on the wrong thing, opening the wrong email. And that's what this training is about. You know, places not to go, what to look for, what's the latest scam, and also just encouraging folks that if you do go somewhere you shouldn't, report it. Don't be afraid to report a breach, because that's the best way to get it under control. Another thing that we've added as a resource, if the county doesn't already have this, some counties have this through their computer folks that they work with, but we now have a cybersecurity coach. If there is a breach in the county, whether it be on a weekday or on a weekend, whenever it happens, you enter the information into our system, you immediately get a claims number, and with that you will get the contact information for our cybersecurity coach. That person will tell you what to do first, who to notify, what to shut down to protect, give yourself the most protection. So again, no cost to you. That's one of the members of being, one of the benefits of being a member. Workplace harassment, sexual harassment, those aren't new, those are ongoing, and we at the pool recommend that you have these on a rotational basis at least once every 2 to 3 years. You know, no matter how hard you're working to do things right, you can get sued. And when you're in the position to be in court, having a routine sexual harassment, workplace harassment training in place will be very beneficial to you as a defense mechanism. Mike Rezac does a wonderful job with that, and I don't know what all trainings you might have already had, Bob, but if you provide your personnel policy, if you have a personnel policy for the county and you provide that to Mike up front before he comes, he will tailor that training to your specific personnel policy and make it work, make it be Hancock County's personnel policy. So we have a great group of trainers, by the way, that work really hard and they're really passionate about what they do. Another one that is born out of the times in which we live is bloodborne pathogen training. And again, this is not for your first responders, your EMTs. Those folks are getting this training. This is geared more toward the folks who keep the courthouse clean, who keep the county grounds clean, who work with the county's parks and recs. Unfortunately, we're finding drug paraphernalia on county property. And first thing they want to do is get rid of it. That's what they do. They keep it looking good. And this is how to go about doing that to protect them and protect liability to them and to the county. You know, they're just faced with a lot of things that in the past we haven't been. So this was put together out of a need for this kind of training. And the last one that I'm going to bring up is our law enforcement training program. What you should expect, what we would expect at the pool, is that a large number of your claims, both property liability and workers' comp, would come from law enforcement community. They're the ones who are facing a lot of risk on a day-to-day basis. They probably drive the most county vehicles. We know the kind of risks they face, and we would expect that. What we've done is to work diligently to put together training for our law enforcement community. Deputies are required to have 16 hours of training once a year. They're continuing education. And the pool has worked with Chuck Sadler in Charleston to make sure that our training fits 14 of those hours. It will satisfy 14 of the 16 hours. We'll come to you at no expense to you. We'll stay a couple days, whatever it takes for you to rotate your folks in and out. We are currently working on the other 2 hours so that you could actually get all 16 hours with our program. And I would also say that the trainers in this area, in the law enforcement, specifically John Bowling, John is former law enforcement himself. He's career police officer in Roanoke and retired from it. So he understands what these guys face, these guys and gals, and he understands the kind of risk that they deal with on a daily basis, and he's passionate. He cares about insurance and premiums, but he cares first and foremost about the deputies and the kind of work they're doing and what they need to do to protect themselves as well as the people around them when they're in pursuit. So I have sat through some of his training, and he is extremely passionate. He does a fantastic job. That's all I'm going to present. If you have any questions for me, I'm happy to answer any questions. We want to be available to you. We know that you're relatively new members. We want to make sure that if you have any concerns, anything that we need to address, that we're here to do that. I provided my business card on that handout. That's my new cell phone number. But for those of you who know me from the past, the old one still works. I couldn't give up that old number. It's been around for a good 25 years. So I answer it too. And on occasion, the commissioner will call me on it and say, oh, shucks, I forgot. So I'm going to stay around for a little bit, and we'll talk. And if there is anything you need from us or any problems, we really want to hear about them because we want to make sure that you're getting the best customer service that we can provide.
Thank you.
You're welcome.
Thank you.
Thank you, Beth.
Absolutely.
Okay, next on our agenda is Joy Reese, Counseling Program Manager for Change Incorporated Home Program Public Hearing Announcement.
Good afternoon, everybody. One of the things is I have to have everybody sign this and give comments of what you think about the program. So I would like to pass that around. I have a couple of things for the commissioners, basically the same thing I have that I'm going to go over. And what it is, each jurisdiction for the Home Consortium, which is the Northern Panhandle Home Consortium, which was incepted in 1996, the lead agency is Wheeling, West Virginia, but they petitioned for and received grant funding in order to provide down payment and closing cost assistance for Hancock, Brooke, City of Weirton, City of Wheeling, Ohio County, Marshall County. And Change Incorporated administers the program in Brooke, Hancock, and the City of Weirton. It's required in order to receive these grants to do public meetings, to try to solicit ideas, comments, concerns about how the program is being run, if it should go in a different direction. The administrators will take that information back to the lead agency, and then they will take it to the Home Consortium. Okay? So a little bit about the background. In it, you'll have the 2019 list of income qualifications. It's based on the average median income for 80% of the population. And here you can see the various differences between the two. And it's also based by family size. The other requirement is they need to be a first-time home buyer. There are some exceptions, such as it's a divorce and whoever was remaining, the spouse, did not receive any compensation from the sale. Or if the house was foreclosed upon and they received, again, nothing from the sale, then they could be considered a first-time home buyer again. The other thing is the house must meet quality standards, which the consortium is very passionate about putting families in homes that will not cause them, difficulties once they get in it, such as a sewer line breaking or lead-based paint causing poisoning, etc. So the Home Consortium makes sure that it's not only inspected by an inspector of their choosing, but also by the Home Consortium. An inspector goes out to see if these homes meet all these housing quality standards. I have a little bit of statistics. Hancock County, since 1997, received over $1 million. Brooke County, over $1 million. City of Weirton, over $1 million. So in total, since its inception, this area has benefited by over $3 million, this down payment and closing cost fund. The other stipulation is the families must stay in the house for a period of 5 years. This allows for community stability, a nice steady tax base, and people who live, shop, and send their children in this area. After the 5 years is over, and the commissioners probably they get a little thing, deed release. And they sign off the deed, then the house has $10,000 equity in that home. If they sell it before then, if they rent it out, if something should happen, we try to recapture that. But the funds do not go back to HUD or the Home Consortium. It stays here. It just goes back in a pool so that another family could take advantage of it, so it's not lost. Questions? Anybody? You mean I'm that thorough?
Very good.
Okay, all right, I'll just sit down then.
Thank you.
Thank you.
Thank you.
Do you want to introduce your
Oh, I'm sorry.
associate or?
Well, she is a new hire, and she's going to be taking over my position since I'm getting a little long in the tooth. And I am one of the population that would be very scared because I have chronic COPD and asthma, and I've had it since my 30s. So,
This is Connie Talbot.
yes. Want to stand up and say hi? Hi.
Thank you.
Welcome, welcome.
And next we have proclamation announcing Brooke Hancock Family Resource Network 25th anniversary. Do you want to say anything to?
Yes,
For this?
since I've come on the county commission, I've attended several other meetings down at the Brooke Hancock Family Resource Network. It's amazing at how many different associations and that get together. I believe there's usually like 30 different organizations, and from anything that's needed, that's the place to go to find it. And I've been very informative to me, and I've had a chance to meet a lot of different people down there and different things to help people out also. So if there's anybody that ever needs that, they're celebrating their 25th anniversary, so I want to make sure we brought this to the attention of the public.
Okay, and this is Lou Ann Decker. Floor is yours.
Thanks for having us. The first thing that's going around is our resource manual. And like he said, if you want to find things out, that's what we do. The family resource networks are called FRNs, and there's one in every county in West Virginia. Ours covers 2 counties, so our book is a Brooke Hancock book. The original grant, we're totally grant funded from DHHR, and the original grant makes us make this book. And there's more books right there in case you guys ran out that direction, sorry. You can find this book online also. We have a nice website that has this book, and it also has, if you needed it, a 1-pager. So that's what we started that we have to do, and that's our book, and it shows all the resources that are available. It's a nice big book. We could just stop and read it, and then we'd be done, and I wouldn't have to talk anymore. But the FRN is a lot more than that, and this brochure tells you what we are. Our mission is to create a network of advocates committed to developing grassroots movements to mobilize, engage, and empower the community for positive change. So we try to get people together to work on things that need to be done. If there's problems in the community, we try to get people together working on them. And at the meeting Mr. Cowie goes to, the agencies all come together and kind of tell what they're up to. And they say, oh, we need this or we need that. And they chit-chat between themselves, and then we might make a meeting out of it, or a coalition, try to get a committee together. So from all that, we've gotten several other grants, and so inside your brochure, some of our programs are written here. One of the, no, this is what we do, sorry. Our programs are written right here, and our committees, and we also are a fiscal agent for many different people. If you read there, like, people in the northern part of this county know about the Children's Food Ministry, Blessings, what she call it, Blessings something. If you guys know Melissa Coble, we're her fiscal agent so she can gather the money. So we do that too. But we have a program called Family and Community Support, and it brings money to families. I have a child with autism, and so if he's living in my home and I don't have insurance for the dentist, it'll help pay for that. Or they need an iPad to be able to talk. Or it's helped people get roofs and things like that. So we have a grant that does that. We have Parents as Teachers, which is an in-home family education program. And these women are trained, and they go into homes of people prenatal till 5 years old. They have to have children in that age. And sometimes they have to teach them how to take out the garbage. But overall, they try to teach them, where is your child's development, and is this child on track, and show them how to teach their children and how to find the right resources. And our other big grant is called a Starting Points Family Resource Center, and that grant allows us to have a pantry with food items and hygiene items that people can come get, and it allows us to do a lot of classes and educational things. So those are the big things we do in the center. It shows all of our meetings that we have. We help with the backpack fair that they give away backpacks every summer. That's one of the meetings here. We have a disability coalition, so we have all our meetings here. We have all kinds of fun events. I left work today. We had a big Take Down Tobacco Day today, and we had all I call them kids. My son is a kid, and he's 27 years old, but from the Opportunity Center, and they came and had a big carnival learning about not using tobacco. And we had fun games and prizes. We have movie nights, and we do it with an educational theme behind everything we do. So that sums it up. If you read this, you'll know everything, but that's the summary of basically what we do.
Well, I'll let you do the announcement. That's your.
We'd like to make a proclamation. We have a certificate of excellence for the Hancock Brook Family Resource Network, and it's for your work and dedication to serving Brook and Hancock communities for the past 25 years. This commission recognizes and applauds the tireless efforts of the employees, the volunteers who have made such a positive impact in this area. So we have this we'd like to present to you.
If you'd like to come up here, we need to get a picture of this.
Thank you very much.
Thank you.
Congratulations.
Thank you very
25 years. That's it.
Well, thank you, guys. Appreciate you coming and taking time out of your day for us. And okay. So down to correspondence. West Virginia Route 2 I-68 Authority, funding request for $4,000.
I move that we make this a matter of record.
Questions? All those in favor?
Aye.
Aye. Motion carries 3-0. And the Erica Gump from the Hancock County Victims Assistance Program, funding request for $5,000.
I move that we make that a matter of record as well.
Okay. Questions? All those in favor?
Aye.
Aye. Motion carries 3-0. Down under new business, commission, consideration of approval to advertise for the position on the Tomlinson PSD board.
I move that we advertise for that.
One thing I'd like to add to this, the applicants must live within the Tomlinson Public Service District. Any other questions, comments? All those in favor?
Aye.
Motion carries 3-0. Office of Technology and Communication.
Get those bids. You missed one.
Number 2.
Gotcha. Sorry about that. Consideration of approval to advertise for the 2020 grass cutting bids.
Move to approve.
Okay, there are two areas on these. There's package 1, Flat Cemetery, Union Cemetery, Methodist Cemetery in New Manchester. Package 2 is 3 Springs Drive Cemetery, Co Valley Playground, and the Peter Tar Furnace in Weirton. And just to make a note, previously there had been at least 4 or 5 packages. And we have managed to take care of a couple of these in-house, and we are very pleased with the work that our maintenance department is doing. So we're down to 2 packages. Is there a motion to approve?
Move to approve.
Questions? Okay. All in favor?
Aye.
Motion carries 3-0. Technology and Communication. Consideration of approval of the Abandoned Building Ordinance Committee's request to start the process to demolish the building at 2824 Middle Run Road. Is there a motion to approve?
So moved.
Mr. Vitus, any comments or?
This building has been on our watch for a few years now. It's the back half of it is totally caved in, and the building's at a slant. And for public safety reasons, we think we need to take it down as quickly as possible. So I'm going to work with Mr. Lucas to make sure that we do all the public notification and everything that's required.
Okay. Any other comments or questions? All in favor?
Aye.
Aye. Motion carries 3-0. 2, consideration of approval to accept the bid for elevator repair work. Is there a motion to approve?
Move to approve.
Mr. Vitus, anything?
This repair work will be done with a grant from the West Virginia Courthouse Facilities Improvement Authority. So we had a pre-bid meeting and a bid opening last week. So Otis Engineering was the low bidder for the project.
Okay. And this project might require the elevator being down
For
Up to 3 days, I believe.
And we'll have plenty of notification out to the public.
Yes, sir. We'll coordinate that with the judges to make sure there's no court the days that we're doing it.
Questions, comments? All those in favor?
Aye.
Motion carries 3-0. Dog warden, consideration of approval to hire 2 part-time employees.
Move to approve.
Questions? They'll have all their paperwork into payroll prior to starting?
Yes, sir.
Okay. All those in favor?
Aye.
Motion carries 3-0. And a consideration of approval of the January in-out report.
Move to approve.
We took in 175 animals and moved 115 out. And they're listed by categories on the papers. Any questions? All those in favor?
Aye.
Motion carries 3-0. County clerk, consideration of approval of poll clerks for the May 12th, 2020 primary election.
Okay, I have to recuse myself on this. My wife has been a poll worker in the past, so I need to step around the room.
I move that we approve the list as presented.
Questions? All those in favor?
Aye.
Aye. Motion carries 2-0, 1 recuse. We could jump down to finance and leave them out there. Okay, under finance, approval of probate and estates, 19 probates, 11 estates.
They've been reviewed and are recommended for approval as before.
There a motion to approve?
So moved.
Questions? Comments? All those in favor?
Aye.
Motion carries 3-0. Exoneration orders? A motion to approve?
Move to approve.
Questions? All those in favor?
Aye.
Motion carries 3-0. We have county commission travel.
Yes.
Mr. Cowie?
I need to excuse myself as a matter of my travel.
Ms. Karen?
$71.42.
I move that we pay the county commission travel for Mr. Cowie. Questions? All those in favor?
Aye.
Aye. Motion carries 2-0, 1 recuse.
Mr. Cowley.
General county bills. Ms. Karen?
General county bills, $99,733.21. P-card payment, all funds, $49,972.14. February expenditures, all funds, $827,794.82.
Is there a motion to pay the bills?
Move to pay the bills.
Questions? All those in favor?
Aye.
Motion carries 3-0. Animal shelter levy fund bills and requisitions?
They're okay to pay.
Move to approve.
Questions? All those in favor? Motion carries 3-0. Library levy fund bills and requisitions?
They are okay to pay as well.
Move to approve.
Questions? All those in favor?
Aye.
Motion carries 3-0. And the sheltered workshop levy fund bills and requisitions?
They are okay to pay.
Motion to approve.
Move to approve.
Questions? All those in favor?
Aye.
Motion carries 3-0. Go to the order. Karen?
No, sir, nothing today.
Mr. Lucas?
Nothing today.
Mr. Vitus?
Just so everybody's aware, our janitors are going through the building on a regular basis, using sanitizer and Clorox wipes to make sure anything that's touched by hand, not any kind of handle or whatever, or wipe. So we're doing what we can to avoid any kind of inborn or airborne bacteria.
Carol?
Yes, just very quickly, so that everyone is aware, WVU continues to be open. We are on spring break next week. The week following spring break, classes will resume, but they will be looking at changing the format into something more online. County offices continue to be open, and we are here. If anybody has questions, we'll be happy to provide any referrals. But I know Jackie was here earlier and brought you all up to speed. So, but we're here to offer any suggestions if we can.
Thank you. Election office, Ms. Jeannie?
Yes, the election office wants the public to be aware that the Secretary of State's office has been in contact with all the counties. They have information on practicing safe interactions with people and materials from the public. Also, the election office wanted to let the public know for early voting and at the polling sites that will be equipped with hand sanitizer, Clorox wipes, and screen cleaners for the public safety.
Thank you. Mr. Wright?
Well, I don't know if this falls under good of the order, but just want to express my condolences to the Alonso family and the loss of their wife and mother. She's a good lady, and she'll be missed.
Thank you. Sheriff Fletcher?
Also express my condolences to the family. Nothing other than that.
We just want to send our condolences to Joe and his family on the loss of Cindy. It's going to be very hard for them to get through this.
Mr. Kelly?
Yeah, definitely condolences to Joe and Longie for the loss of their family. Also, I wanted to thank the opportunity to go up to read at New Manchester for the Dr. Seuss Read Across America Week. I had a good time at Mrs. Stepping's first grade class. Also wanted to let people know that the Festival of Nations that they usually have in Weirton on March 21st has been canceled because of this, to take no chances. And also wanted to give a shout out there to West Virginia Corp for their training they did that I've attended there on the cyber security and everything. Mike does a great job. Thank you.
Okay. Mr. Davis?
Again, condolences to the Alonji family, and like to wish everyone a happy St. Patty's Day on Tuesday.
Okay. I also like to extend my condolences to Joe and Cindy. They happen to be neighbors of mine, so it's been very difficult for them. At least the last 3 or 4 days were extreme, and in one way it's very sad and very heartbreaking, but in another way it's very relieving, and she's blessed and no longer suffering. So, and I have something here from these fellows that film our meetings every week and get them out to the television station. I believe on local TV Comcast it is channel 14. However, there's some volume issues that are not related to these two guys. So they have suggested, and it would encourage people, that those that watch it, to check out topperstation.com. That's TOPPER station, STATION.com, and scroll down to the Hancock County Commissioners, and it's a more in tune to our voices. They invite you to watch it. They air on television Tuesdays and Wednesdays, 6 a.m., 4 p.m., and 6 p.m., but on the Topper station you can see it at any time at your convenience. And we thank you guys for a job well done, and pretty amazed at how many people actually do watch that show. So, and I have nothing further. Anybody else? All right, our next meeting is March 26th, 2:30 p.m. in the Commission Room. Without anything further to come before the Commission, I declare this meeting adjourned. Thank you.